Hello everyone, Assalamu alaikum. In this video, we will discuss about the esophagus. Now, esophagus is a tube-like structure which is 25 cm long and connects the pharynx to the stomach. Its upper end begins from the lower border of the cricoid cartilage opposite the C6 vertebra, and then it passes through the thorax in front of the vertebral column, and its lower end enters into abdomen via an opening in the diaphragm, and it ends opposite the T11 vertebra by opening into the stomach. So as we saw here, the esophagus begins from the lower border of the cricoid cartilage opposite the C6 vertebra, and then it passes through the thorax in front of the vertebral column, and its lower end enters the abdomen via an opening in the diaphragm and ends opposite the T11 vertebra and opens into the stomach. Okay, let's talk about its relations. Anteriorly, it is related to trachea and recurrent laryngeal nerve. Posteriorly, we have the prevertebral fascia and bodies of C6 and C7 vertebrae. On the lateral side, on both sides, we have lobe of the thyroid gland, common carotid artery, and the thoracic duct. Now let's discuss its blood supply. It is supplied by the inferior thyroid artery. What about the lymphatic drainage? It drains into the retropharyngeal lymph nodes, paratracheal lymph nodes, and the deep cervical lymph nodes. What about its nerve supply? Its parasympathetic supply is derived from the branches of the recurrent laryngeal branch of the vagus nerve. And we have its sympathetic supply, which is derived from the periarterial plexus of the inferior thyroid artery. Now let's discuss its clinical anatomy. Esophagus has 4 natural constrictions. While passing any instrument, one must be careful at these sites. Okay? Now let's summarize. Esophagus is tube-like muscular organ connecting the pharynx to the stomach. It is supplied by the inferior thyroid artery and drains into the retropharyngeal, paratracheal, and deep cervical lymph nodes. Now, in question, you can be asked about the relation and blood supply of the esophagus. So I hope you found this video helpful. I'll see you in the next video. Till then, take care. Allah Hafiz.